Hi, everyone. Are you interested to learn about your positivity and how that affects your health? As far as your attitude, if you're focusing on complaining or focusing on gratitude, what does that do to your health? So today on This is Live, Beautiful and Messy, we're going to be talking with a good friend of mine who is a doctor. And I first have to share how we met because it's just such a great reminder that you can meet people who are going to be very influential in your life at the strangest places. I was sitting outside of a concert in Chicago 10 years ago. It's probably about 10 years ago this time of year, maybe earlier in June. And this nice couple walks up and sits down and talks to us, and we've become very good friends ever since. I went to her wedding a few months later, and she is part of the Positive Focus board because I coerced her into helping me grow this vision. So she brings a lot to the table for that. Dr. Sharyl Truty, welcome. And first, can you share a little bit of background of your, because I know you're an integrative medical doctor. So can you kind of share a little bit about what that means?
Hi, Carol. It's great to be a part of this today. So thank you very much for. I'm an integrative medicine physician, and most people are like, what does that mean? And it really means that we're usually physicians who've trained in traditional, medicine as either an MD or a DO. And then we've done some extra, a lot of people in natural. A lot of people have done that. University of Arizona, and Dr. Andrew Weil has a special program for physicians. And so we try to keep one foot in both worlds so that we can offer all of our patients kind of perspective from both a holistic and natural component and from a more traditional medical component.
I think that is so powerful because it seems like either side often wants to say, theirs is the best way. And, just to be able to talk to somebody who knows both realms. And I mean, I've always said, if I need, people often will complain about chemo itself. And if I got into a situation where I needed it, I'm not adverse to using it. I would certainly want to look at all my options too. So being able to speak to somebody who can share a homeopathic natural way along with the Western medicine or the general practitioner, I think is amazing. And Sylvia is joining us. I totally forgot, which I usually do at the top of the broadcast, is, I'm a hugger. So if you're joining us today and need an extra dose of hugs to heighten your celebrations or lessen your sorrows, put your name and your location in the comments. And I'll keep an eye on comments too if you have any questions for Doc Sharyl. Again, this is a general call. She cannot diagnose things over a video call like this, but she can give some ideas on some basic things. And that's something we're kind of going to talk about today is even outside of seeing your doctor, which she's going to tell you kind of what an integrative doctor looks for and would tell you to look for. But ways that you can help yourself before you even get to a doctor. So she just blogged for us recently about stress and different things to do. So, Sharyl, as you know, you're part of Positive Focus. So in a medical standpoint, what does remaining positive do to you physically?
Well, I think it goes back to basic, brain physiology, which I really realize how important, scientific studies have shown, impacts on, the physical aspects of the brain and the nervous system that we can have and are done using functional MRI, which is a way of seeing what areas of the brain and we're under certain situations, and a lot of blood testing for various neurochemicals can be done as well. And it's amazing, we found in neuro and neuropsychology that, our brains are sort of wired for survival. That makes sense, and
Yeah.
part of that survival is fear. And, but people realize that, and it sounds like almost a downer, but the flip side is that is we found that we can condition the brain to look at things differently. And that while there is maybe a little bit of a tendency for all people to have fear and maybe a little more negative thoughts, that we can actually train the brain to have a more positive outlook. And then that positive outlook has led to
Uh-oh, she's frozen, or at least frozen on my side.
So, yeah. I'm having some freezing it here and there. But
You know what? That's technology. It's going to happen. So we that's part of why the show's called "This Is Life: Beautiful and Messy."
Exactly.
Things happen that we don't have control over, but we do have control over how we react to it. So I usually just do a little song and dance when it freezes up and try to entertain people. So I have a question to you regarding what retraining the brain. I don't recall where I read it, but it was something scientific where that some people are innately programmed for more fear, and other people are, that their programming is for a happier disposition from the get-go. So both sides can be trained. Like if you have that disposition of happiness, it's going to be easier for you, obviously, to focus on having a positive attitude than not. But it's showing that it's possible.
Yes, absolutely. Like anything, medical have some genetic, disposition to, developing certain diseases more than others. And we all have a different set point that we perhaps may start with in life. But definitely there is a lot of evidence that with therapies that we often consider to maybe be, sometimes I don't think we really realize how much they affect our physical chemistry, like mindfulness and meditation and breath. And you can actually make physically seen and studied changes in brain chemistry and brain physiology. And I think that that's what's so amazing. We take for granted some of these things that maybe we do, maybe from a more spiritual aspect, and we don't realize how much it can actually impact us physically.
Yeah, I think about that, like even on past calls for this one, I always recommend one of my tips for people is to always take some deep breaths, because when we get into that fear space, we're usually constricting ourselves and cutting off the oxygen that we really need to be able to move through it. So it's an easy thing to forget because we're in an anger space or a fear-based space or whatever, but truly those deep breaths can give us the oxygen we need to move through it.
Yeah.
So
absolutely.
So when you mean mindfulness, what do you mean about that?
So mindfulness is a type of practice that where you keep your focus on the present. A physician, father of this that often is quoted is Dr. John Kabat-Zinn. He's done a lot of studies out in California on mindfulness, and he's a big proponent in the medical community. And it's basically stay in the moment. So if you're eating, that is where your mind is, on the taste of the food, on the texture of the food, on chewing it, and not on other thoughts about how your day is going or what you were upset about. Or if you're walking, the same thing. You're paying attention to this present moment and what's around you and what feelings you're experiencing. And that's essentially what my naturally to us, big surprise, our mind wanders very, very frequently. And so it is a skill that has to be practiced to a certain, and a lot of people who do have found that they've been able to make differences in things like anxiety or even just physical problems associated with the GI system or the heart system by doing this mindfulness-based practice. So,
well, and I love that you call it a practice, because I immediately think, well, I can't do that because my mind is thinking about right now. It's already got 3 different thoughts about when I get off the phone with Cheryl, I'm going to do X, Y, Z. So it is just like most things that we want to get better at or good at. It requires practice. I do use that example a lot, that if I could go to the gym one day and be in great shape, I would do it. But it's the consistency and the repetitiveness and the practice to make it part of a habit. And I tend to be a multitasker, so I'm going to work on coming up with a mindful practice for myself I do meditate and things like that, but when I'm not in meditation, I am multitasking like crazy. So to really stay present, I think is a really important tool to use.
Well, and we all multitask. We all are trying to and get a lot done, in our day. But what a lot of times most of us don't realize is multitasking to a certain extent is a little bit of a myth, because our brain can truly only focus on one task at a time. It just can shift attention very quickly. And that's what often happens, is that we shift attention from one thing to another when we're find that if we just picked one thing and completely focused on it, that we might actually be a little more efficient. But I certainly have my fair share of multitasking. Yeah.
So as far as meditation, is there a particular way that you recommend for people to do it? Because I know there's so many varieties of meditation. Or is it just simply quieting the mind? What is it that you would recommend?
Well, I think you should explore what works for you individually. I think no one is right for everyone. A good way to start is just simply by doing work with the breath. In and breathing out, and you can read different breath exercises that tell you to count for so long, hold it for so long, count out. But in my mind, perhaps maybe at an advanced level there's a difference, but when you're starting out at the beginning, I would do whatever feels comfortable to you, and just start that. It could be 3 breaths, and it could be for any amount of time, for a few minutes a day. I usually recommend that for people who are newbies who are trying to try something out. Yeah. If you're ready, if you do a yoga class already, done breath, and you're explore something new, then you can do everything from focusing on a visual object you have in your mind to focusing on a word, focusing on your breath, and there's different breathing techniques. And there's a lot of wonderful apps out there. There's a lot of wonderful yoga, Tai Chi instructors that have a lot of training in this. And so there's many different places that you can go to learn more if you're just sort of starting out.
Yeah, and I like that because I think it's important. I know for myself, when I'm starting something new, I want to be good at it already. So I get very frustrated if it, takes more work than others. Even like yoga, I've tried it a couple of times, but I am not really good at it, so I give up very quickly. And it's the whole point of yoga is to continue to stretch and grow. And So it's really important for people, especially for if you're like me, to know that it is a process. And it could be something that comes naturally to you and it does click right away, but it may be something that you need to grow into. And trying different methods. Like for me, I do better with guided meditation than I do trying to just focus on something. But that's what works best for me, at least right now.
Yeah, I think you bring up a really great point, Carol. And, is that, again, like you said, it's a practice, and we're often hard on ourselves because we don't get it right. And so don't feel bad if it's frustrating. And usually the number one rule of meditating, not to be hard on yourself when your mind does wander, because it probably will, and to just gently bring it back to whatever your choice focus is. And Deepak Chopra, says, and I recommend too, if it's something you really want to do, commit to it for a good 40 days, and no matter how little time you give it, even if it's 2 or 3 minutes a day, do it consistently. The end of those 40 days is where you'll probably see that, oh yeah, this is starting to work, and it's much easier now than when I started.
So I'm curious as to what got you into integrative medicine rather than just the regular practice of medicine.
Well, it's a long story, so I'll give you the brief version. Someday when I give out my longer version. But I was an athlete. I played college basketball, and I just was, as most athletes, interested in wellness, and then interested in maintaining optimum performance. And so when you look into how to maintain optimal performance as an athlete, you begin to learn a little bit about mindfulness and getting into the flow so that your body is one. And that's really kind of what started it. And then interest sort of blossomed when I decided to go to medical school, to try to be able to learn more about health and fitness, as well as, the mind. And then I started doing some Tai Chi in medical school, and decided to go to China and learn Chinese medicine. And that's sort of what started everything off. And then from there, a lot of patients always asked me questions because I practiced acupuncture, herbal. That's what led me to do the fellowship with Dr. Weil about 5 years ago. And it's definitely, I think, something more and more people are aware of and wanting to bring into their health, and just often sometimes struggle where to go in our current healthcare system with that.
Yeah. So when a new patient comes to you, we were talking about having a positive attitude, and maybe it's something not super serious, or you have some serious information to share with them. How do you give people advice on, tools to focus on the positive aspects of whatever's going on, or to stay positive to help them with their health and healing?
Well, I think, I usually try to talk to people about giving themselves a little more attention, no matter, what's going on. I think a lot of times we're looking to please other people, looking to please other institutions. And sometimes we often don't put our health problems of just to look is to take, is there a place for me to take a little bit more care of myself, and giving myself, permission to do that, because we can often be hard on ourselves and not feel that, we're really need to do that. And then, from there, it's looking at what's going on in the larger perspective of your life and your, so, what currently is bothering you in your health or in your emotional life, how does that compare to what your long-term life goals are, and trying to put it into perspective. Because I think a lot of times when you're having a problem at the moment, it can seem large and it can seem very difficult. Whereas if you put it in perspective of everything else in your life, will branch off into gratitude, practices, because, they begin to, and the things that are going on very positively in their life. And then is to look at the problem itself and see if there can be anything looked at as far as it being a learning experience in the long-term aspect of their life. Is there something out of here that, even though it's very, I think if when you start to look at those things, it changes your perspective. So no longer are you just focused on the pain or the uncomfortability, but you're sort of looking at a larger picture.
So if you had some suggestions for people today, on what they could do for mindfulness or feeling better, just to start incorporating these tools into their life, what were a few, 2 or 3 that you would recommend?
Well, I would recommend, I think a lot of us know that importance in being healthy and to, do some sort of regular physical activity. But to take it one step further and go, is there some type of mindful breath or meditation exercise that I can do every day? And just start with that. And pick something, whether it's a simple breath exercise or maybe it's attending a yoga class. Pick something and to just try to do that again for 40 days, as we talked about, and kind of maybe even keep a little bit of a journal on how you felt at the beginning and how you feel, a month and a half later, and see if some of your perspective has changed. So the second, another thing besides that is, to just look at anything that's particularly bothering you and to see how it fits into the rest of your life, and take a look at that, and how maybe you might be able to look at it as a learning experience. And maybe that might come easy to you, maybe, getting the help of a psychologist or a cognitive behavioral therapist, or if you have a good relationship with your physician, that might be something to consider. Or maybe even a holistic physician, talk to them a little bit about it would be some good places to start.
I think those are great tips. And also I would add, to focus on what you can appreciate, what's going on in your life. Like if something right now physically is not well, but to really, in that journal that Dr. Sheryl's telling you to keep, write down what you appreciate every day. Because really when you focus on your appreciation, even when I start a coaching call with people, I always ask them to tell me 3 things that they appreciate about what's going on in the day, or with whatever the situation is that has got them upset that we're on the call for, is to come up with things that you appreciate about that. Because I really appreciate how you mentioned that we can see this as a learning experience. It's so easy to go into blame or guilt if, a doctor or anything truly is going on in our lives that we're not happy with, to feel bad about, like, how did I cause this? Or I should have done something before it got to this. Well, you can't change the past, but you can make the future better with mindfulness, with exercise, with eating, with appreciation. I mean, there's so many different ways that you can enhance your life moving forward.
Yes. And what the reason why a mindfulness or a meditation or a breath exercise is important to do on a regular basis is because what it does is it actually helps us to take a step away from a lot of the emotional charge that comes with any difficulty we have, whether that's, an argument with a loved one, a different philosophy that we read in the newspaper or from our, political leaders than what we believe, or if it's, something going on at work. There's any number of triggers we all have. But sometimes we don't even realize things that set us off emotionally. And so by doing a regular meditation mindfulness practice, it actually trains the brain to somewhat separate or take a second and process the emotion separate from the actual event. And that's where we really have the power to create change in our life. If we want to have a better relationship with a loved one that we struggle with, we can't control them, but we certainly can control how we respond. And the same thing with a boss. And in the same thing, even when we have pain, if we begin to have stomach pain and diarrhea, maybe we can't necessarily grab something to make the pain go away immediately, but we can change how we. That's where the real powerfulness comes, is being able to not just immediately emotionally react, but take a quick second and process it from a higher brain function rather than sort of the more instinctual functions. And that's really,
I like that, because it just made me think when you were even bringing up the outer things that might stress us out, as far as people that we disagree with, whether it's political, religious, or any of the things that we find ourselves being stressed out about. Our stressed out experience of that is not helping the situation that we're stressed out about, and it's certainly not helping us physically. And stress is one of the top things that creates disease. So I would encourage everyone to, whatever you're passionate about in life, to look at it in a way that is helping you rather than harming you. And by no means am I saying that things that are going on in the world aren't things that you should be.
We just had a freeze.
Oh, are you back?
Yes, I'm back. We had a temporary freeze there. Yeah.
So it's really, I think that mindfulness is so important for, again, we can't control what's going on outside of us, but we can control what's going on inside of us through mindful techniques and meditation, yoga, and breathing, and appreciation, and all those things. So I always like it. Go ahead.
Well, and once we do that step, and taking that second to separate, from whatever we feel, then, to take that positive step, like what we can appreciate, can put this in a positive spin, then, takes it even one step further, where we sort of, create in our brain this focus on the positive, which actually, will change the stress response. Because obviously, if we're creating all these chemicals in our body that, affect our body in a stressful manner. But if we do the opposite, we create chemicals in the brain and very healthy and healthful for the body. And that's where the power of positivity lies.
Well, and I'm all about the power of positivity, so that's perfect. I think it's also, it just made me think about the fact that it's the difference between complaining about your illness and why did this happen to me, and focusing on the solutions. Like, we can certainly complain when something happens that we don't like. And I would love to tell you I never complain. Because of the work I do, I catch myself much quicker than most people, but I am still human and I still complain. But I do know that it's not serving me, and it's certainly not stopping whatever's going on that I'm complaining about. For me, it's giving it more energy because I'm so focused on it. So when I get to that space, then I'm just like, okay, what do I want? And I want to be peaceful. I want to be happy. I want to be kind. And that helps me think about solutions rather than complaining. And I think it's so very easy to complain.
Oh gosh, yes. I mean, again, it's because playing a little bit of our way of process. But then again, going back to our earlier conversation, we're somewhat programmed from a instinctual point of view, to focus on threat and in order to survive and to be able to avoid it. And so it's just to some extent a little bit inherent in us. But we absolutely have the ability to change that around, again, just by repeated work on it, and not to expect that it'll happen overnight. I've been together me, being on Positive Focus board and really putting these concepts into practice, both in my personal life and in my profession. It just takes time to do that.
Yeah, it does. And but I do think even like if you did the journaling, you would realize like sometimes we don't even see the progress we're making because it is a subtle change. But then all of a sudden a month later, you're like, wow, what would have triggered me a month ago is so easy to ignore now because of the work I've done. So I highly encourage people to keep appreciating the progress that you're making and be gentle with yourself when you step back into that survival mode of defensiveness rather than coming from a space of love, because it's certainly easy to do. So Sharyl, what's next in your world? Because I know you've got a lot on your plate. So I really, really appreciate you taking the time today to share some mindfulness with the PF audience.
Well, thank you, Carol. And, hopefully we can do this again real soon sometime. We have some exciting things on a practical level here in the Jacksonville area where I'm at. We have a workshop coming up for those who have neck pain and migraine issues. And that's coming up a week from today on Thursday in the evening. And you can go to my website at balancedphysiciancare.com. Again, that's Balanced Physician, and find out more about that if you're here. If you're part of more of our global community, I blog on a regular basis. And so if you are interested in just some more integrative topics and interested in kind of having a perspective like that, please check me out on Facebook. Check my practice, Balanced Physician Care, out on Facebook. Or check our website and sign up for our blog.
Yeah, and I will come back after we're done and share all the links for that, so you'll be able to easily find it and find Sharyl, because she's definitely somebody that you're going to want to connect with. I so appreciate that day that you guys sat down with me at the concert.
Yes, it definitely is. I think for those of us that place a lot of feeling on energy, and how positive energy can just create more positivity in our lives. That's one of my big examples that I go back to on a regular basis. And being on the board of Positive Focus, as a physician, has really been important to me, because I really think that focus is and book clubs is just creating, just sort of this place where you can go if you're looking to create this change in your life, in your health. Really simple and easy way to bring that positivity in your life and maybe even improve your health. So.
Perfect. And that brings me to a good thing. What's up next for us? I don't know if you're aware of this book or this doctor. Dr. James Doty, he's a neurosurgeon. Have you heard of him? he has a book out that is called Into the Magic Shop. And we've started the book club again. That's what I started Positive Focus with back in 2007. And we became a nonprofit in 2009, but I was doing events before. And so I'm going to do it online where it's a video call. It won't be a Facebook Live, but you can join from wherever online at the end of this month. And then also in person here in Chicago the next day we'll be doing it. That's for June. And in July, we're going to be talking about your life's purpose. If you followed before, Michael Lozier, the author of this book, has been on the show talking about it. And so we're going to be dealing with that for book club in July. And then in August, a book that was recommended to me called The Abundance Code is going to be what we're talking about. And again, you can join me from wherever, one day online video chat, and the other day if you're here local in Chicago. And when Sharyl mentioned Jacksonville, it's Jacksonville, Florida, in case you're unfamiliar with where that is. But she left me in Chicago over a year ago, almost 2 years ago now. So thankfully for Facebook and all that good stuff, and we're still able to do video calls for our meetings and things like that. So thank you, Sharyl, for joining us. And yes, please come back again. We can continue to talk about mindfulness or anything else that will help inspire people to live their best life. Because that's what we're here for, is to heighten celebrations and lessen sorrows. Cheryl, do you have anything in closing?
Well, and if any of your Facebook Live followers have any specific topics, please feel free to reach out and let us know if there's anything specific when it comes to sort of holistic health that you'd be interested in learning about.
Oh, that's a great idea.
I hope everybody has a fantastic day today.
Yeah, thank you. That's a great idea. So if you have any suggestions either today or later, just put them in comments, and I'll schedule another time for Cheryl to come back, because she's always my go-to person about this anyway. So might as well share her with everybody. Thank you again, Cheryl. We will talk again soon. And everybody, thank you for joining us. And next Tuesday and Thursday, I'll be back for This Is Life. I'm not sure yet who my guests are. It might just be me, but it'll always be about something to help heighten celebrations and lessen sorrows. And remember, you matter. You matter to me, you matter to the world, and most importantly, you matter to you. So we'll talk again soon. Have a great day.